A cleft palate is essentially a congenital malformation that is in the process of developing before the child is born. Different tissue doesn't develop as we would typically see in other individuals, and the resulting defect is that of a cleft palate itself. Some of the clefting can be seen simply with the lip. Some clefting will involve the lip and the palate together, and yet some patients will develop a cleft that involves only the hard palate. Now, these clefts, essentially by the nature of what they are and not having the tissue fused, will result in having communication between the nasal cavity and the oral cavity, particularly if it involves the hard palate. The clefts that involve the lip clearly are a cosmetic issue, but also functional. One of the first things that parents will notice in some of the cleft kids is the more complicated nature of breastfeeding or even feeding with a bottle in those things. So it is not exactly a diagnostic dilemma, but it's pretty well known, as soon as the baby is born. In regards to cleft palate, the nature of the complex deformity that it is involved also requires several different disciplines of physicians to be working with the patient. The defect itself also involves speech issues, hearing issues, and obviously the structural defect itself. Because of the complex nature and the timing of treatment, the most appropriate way to address these kind of issues is in a team approach. The cleft palate team in general will consist of plastic surgeons, oral maxillofacial surgeons, orthodontists, as well as pediatric dentists, speech pathologists, geneticists, and even social workers. So the team itself gets to be quite large, and it is just a major undertaking for not only the physicians to keep this organized, but it's a very good resource because it's very difficult for the families to keep all those disciplines organized, which makes the cleft palate setting, the clinic setting, a lot more amenable to good patient care.